Facebook. It says right at the top. So
Yeah. So we're being recorded, and I believe we are Facebook Living. Let me just make sure that that is true. Go head over to the paid Facebook. Yep, and there we are. So welcome. I am so thrilled. Good afternoon, everyone. I'm Dr. Jennifer Gardella, and on behalf of the team at BCHIP, welcome to one of our monthly, semi-monthly live interviews that we do with the great people that make BCHIP work. I have with me today the BCHIP intern, Abigail. Abigail, how do you say your last name? Stauffer?
Stoffer.
Stoffer. Okay. See, we always ask here because I never get the last names right. So Abigail and I are going to be talking about all the great things that she is doing as a student intern at BCHIP. So Abigail, why don't you start off introducing yourself?
Sure. Well, thanks for having me. I know we met a couple weeks ago. I really enjoyed your talk that you gave at the Chamber of Commerce. It was
Thank you.
wonderful. Kim and I talked about it the whole way back. But I'm I'm Abby. I am a student intern at BCHIP here. But I'm a student at Westchester University, which is down in Chester County, where I'm from. I am a public health and pre-med student on the bachelor's to master's program. So I'm kind of taking graduate and undergraduate courses at the same time.
Brilliant. Brilliant, brilliant.
I like keeping myself busy, that's for sure.
Yes, you must be. Do you want to be a doctor?
I do. I do. I want to go to medical school, preferably somewhere in women's health. But I'm kind of flexible on all of that.
Working with the team at BCHIP, it is an all-female team, and also you are learning and seeing all the different avenues where our healthcare system needs support. So,
Absolutely. Absolutely. There's a lot of programs here at BCHIP, so there's a lot to get involved with.
yeah, so why did you head up to Bucks County and join the BCHIP team for the semester?
So this sounds like a silly answer, but my internship supervisor or my professor at Westchester, I forget, I get the terms mixed up.
Yep.
But my professor at Westchester, she sent out a spreadsheet of like 20 different internships that were available. Bucks County was at the top, and I was kind of in the mood to do something that was expansive, that I could kind of dip my toe in a little bit of everything. It's become a running joke that I literally only study women and children at Westchester. So I kind of wanted to make sure I'm like getting the full range of everything that there is to do in public health before I graduate.
That's awesome. So you came up and tell us what you're working on. When we first jumped on this Zoom call today, you said you're working on a little bit of everything. So I can't wait to hear what you're up to these days.
Yeah, so a little bit of everything is pretty much what covers it. I started out with building out a database that lists all the current PA House and Senate legislation for mental health. So it's just one document that has everything and it's ongoing. That's kind of my major project for the semester. I'm helping one of my colleagues, Colleen, with a bunch of different questionnaires for her long-term care opportunities. I'm working on different graphics, one for our big event that we have in June, a bunch of different graphics, a bunch of different PowerPoints. I'm doing a educational PowerPoint on RSV right now for Becky, who does the vaccine program. So really a little bit of everything.
Yeah, you are. You're not only getting like the advocacy work, but you're getting the hands-on experience and the fundraising work, which is so important to any nonprofit, especially in the healthcare sector. So that's phenomenal. So what do you think about what BCHIP is doing up there in Bucks County?
I think it's great. I mean, to be able to talk, I didn't, ooh, let me collect my thoughts. There's so much to do, right? So it seems a little overwhelming and intimidating as a student intern to come in and be like, we literally do everything. Like, how do you describe doing everything? Because that's what it takes to be a healthy community. And I think what BCHIP does really well is having head people to kind of drive their passions towards specific programming. So like Colleen is interested in long-term care. Becky's interested in vaccine programming, and Sam is running the tobacco cessation programming. So there's a little bit of something for everyone, which I think kind of embodies public health as a whole. But there's really not a world I could see where it wouldn't be important to have BCHIP as like some sort of program like BCHIP, where their community can come to kind of one spot and be able to do all these different things.
Yeah, that is such a good point. I came onto the team sometime well after the start of COVID. I've been with them for about 18 months now. And one thing that really inspired me to work with them was that during COVID, they just weren't a vaccine mandating organization. They were really in the center of coordinating services so that the hospitals had a place to come together and share information, which I think is so critical. So many communities didn't have a BCHIP, and that is one need that it fills. So when you talk about the long-term care initiative, Kim is able to step in and organize the people of the long-term care facilities and say, hey, we got a problem.
Absolutely. And I like how you mentioned the hospitals coming together. For a long time, it's been an issue, not just in Bucks County, but like all over Pennsylvania. I'm sure you can say the things about other states too. Um, Hospitals are a little bit more competitive rather than collaborative. And to be a healthy community, you have to have collaboration and work together. Otherwise, you end up getting the same studies about the same things happening over and over. And nobody's really benefiting as a whole rather than by themselves. And I think BCHIP being that sort of missing piece that connects them all together to be able to not only connect them together, but connect them with programs they may not have known of before coming to BCHIP is a really excellent initiative.
Yeah, it's an amazing part of what the work that the team does there. What do you think you're going to go back to Westchester and tell your advisor and your peers when this is done?
I tell them all the time. We have our little biweekly logs, so I get to fill out my little logs every couple of weeks. Um, I love going back and just being like, obviously the team is like fantastic. I was like their daughter on day one. They were like, "Let me take you in, child, and teach you everything there is to know." And so they're all really kind and welcoming here. But definitely going back and being like expanding your horizons of what you think you're interested in. Um, because if you read all my papers, they're all about maternal mortality or maternal care or infant mortality or infant care, or child, whatever. So it's always maternal and children for me. And it's hard to like either A, solidify your passion in something, or B, learn that there's like something else that really what makes you want to drive your passion towards something.
Mhm.
Uh, and I think BCHIP I want to bring that back and be like, make sure like you choose an internship that maybe you aren't interested in and not interested, that maybe you aren't like how do I phrase that? Do you know what I'm
Well,
trying to
it's
say?
something that you normally wouldn't gravitate to,
Yes.
but in
Yeah,
some way can expand your mind, offerings that are out there for you, opportunities.
exactly.
You may have never, I didn't really know a lot about BCHIP before I started working with them. And all of a sudden it's like, wait a minute, we have a smoking cessation program that's free. We have advanced care directives that are free. We have someone coordinating the hospital system for us. Like these are huge programs that are instrumental to helping our county get healthy. So for you to
Exactly.
see that at your age and say, okay, you may care about the women maternal health, and do not get me wrong, that is critical. We need you out there, Abby. We need you staying
For
in
real.
school. We need you getting educated, and then we need great people like you out there advocating for those programs as well. So that's important. But for also you to be aware of, if you go on to be Dr. Abby, which is sounds like you're headed in that direction, it's so critical for medical services to know about healthcare supports. So when a client comes to you, or I'm sorry, a patient comes to you and says, I don't have health insurance, or I can't quit smoking and I don't know what to do, or, my family and I need to have those hard conversations about healthcare directives, you're like, oh, wait a minute. I have a
Absolutely.
model. And if your county doesn't have a BCHIP, then, that could be something you could blaze a trail eventually to say, hey, I've seen this before and I've seen it done real successfully and how it really helps.
Absolutely. And I think I even said this to Kim in my initial interview to be an intern at BCHIP, to be a doctor, to be whatever you want to be, having a very closed off like skill set is not going to be the most, like, I'm not going to be the best doctor by saying, well, I know everything there is to know about women and children's health. I
Right.
also have to understand what are their living conditions, what are their economic positions, what are their smoking habits, their drinking habits, are they dealing with stress, are they dealing with whatever it is that they may be dealing with? And public health is it as a community, it's important to understand that there is a whole like world out there that's all encompassing to create who we are and the experiences that we're having.
Yeah, and also, in maternal health and that entire sphere, the idea of vaccines is becoming so it's a problem, right? We have a lot of bad information out there. So for doctors like you, see, I've already given you your MD degree, but for doctors like you to be able to say, wait a minute, let's go to the organizations that have that critical information and partner with them. And how do we, without really dictating what people do, come at it from the standpoint of let's educate rather than dictate is something, obviously we have a stand
Right.
and which is
Yeah.
important, but we also have to understand that other people may not be ready to hear that in such a forceful way. And it can be instead a coming together of.
Yeah.
And
And yeah, medicine is intimidating. It's intimidating to go to it's intimidating to become a doctor. It's intimidating to go to the doctor. It's intimidating to talk the medical language. And even if it's not in medicine, even just health in general is sometimes taboo or hard to talk about or politicized or criticized, or you want to put in any adjective in there.
yeah, right.
So it's important to have those discussions. And I even had one conversation with Sam where she gave me some really great perspective on the fact of like, I typically write at a collegiate level. Not everybody reads at a collegiate level. And it's not something that you think of until you're actually doing it in practice. And I thank the BCHIP team like every day. I'm like, you put everything in perspective for me.
Yeah, that's an amazing realization. President Obama, when he was in office, was writing, I think, at a 10th grade level, and they had to knock them down to sixth grade because people don't normally, you have all that education or not, but if you did, you slip back. You don't
Exactly.
really talk like you do in high school or even in a college paper. So that's really important. It sounds like you're just getting this whole world experience up there. They may keep you, or you may want to keep them. I'm not sure what's going to happen.
I hope they keep me. I like them. I hope they like me. They tell me they like me, but
Well, that's phenomenal. So what goes on with you after this then? You leave the BCHIP internship at the end of the semester, and what do you move on to?
I wish I knew. I have I have to, I technically don't graduate until July or August. I have
Mhm.
one more credit to finish up and then I'm done my undergraduate degree. But like I mentioned before, I'm in the bachelor's to master's program, so I'll be going right into my master's degree.
Um,
Also in public health. I just wanted to make sure I have like a really solid foundation of public health and its understanding before I go into medical school.
right. Brilliant. And like I said, we need informed doctors who just don't believe that their schedules revolve around their patients, that we have real jobs around here. And again, I can't talk about BCHIP enough to say the good things that they do, but they also promote what some of the hospitals are doing, which you get to see as a doctor. One of the hospitals has a whole program where you can like literally make an appointment for the ER. And I was like, that is brilliant because people have lives and schedules that sometimes to miss work as a single mom, which you will encounter, who,
Yeah.
that hourly wage is important to her bottom line, especially now with the price of food. So, and so for you to hear about all this early on in your education and years and real world adulting experience is great.
Yeah, and I think what's also really great that BCHIP is doing, and I don't think I mentioned it before, but if I did, I'll just repeat it because it's really great. Um, I mentioned them collaborating with the hospitals and bringing them new resources, but I find like through these different meetings that I'm attending, they're also learning how to use the resources to better the community, to better the experience for their patients. So like one hospital may have an issue with substance use disorder more than another hospital that has and bigger issue with homelessness. Like there's each hospital's community is a little bit different, even though we're all in Bucks County. So even saying Bucks County as a community is really big. So they help break it down and individualize it. And I think the conversations that BCHIP helps facilitate with these extra programs, like Find Help, for example, are able to better be utilized and patients themselves directly see the benefit from it.
Yeah, Find Helps. Kim loves Find Help.
Oh yeah. Oh
A
yeah.
big proponent of Find Help. It's a great website that's just an abundance of information to get. And what I love about it is that an individual can use it, but she really also pushes social workers and caretakers to use it as well and make referrals so that, to try to cut through some of the red tape because in healthcare it's extensive.
Absolutely.
Fabulous. Well, Abby the intern, be careful, by the way. I had an intern, I think 25 years ago, Jenny the intern, and we still call her Jenny the intern, like when I talk to her on Facebook. So, um, lovely to interview you. You
Thank
please
you.
tell whoever raised you that they did a great job, that at your age you can just come on here and talk so passionately and intelligently and yet be very relatable. I think you'll make a great doctor. So please stay in touch with us long term. And do you have any final thoughts? I think I already asked you that.
Yeah, I think just thank you for having me. Thank you for letting me talk a little bit. It was a little bit more impromptu than I'm used to, so I love that. I'm full of spontaneity, so it was super fun. I appreciate getting to work here at BCHIP with the team, and they're amazing, and you're amazing. I love listening to your speech that you gave too. So just it's been a great experience all around.
Okay, promise me you'll come back before before you leave and fill us in on on the rest of your internship. We'd love to hear
Sure,
what else you've been up to.
sure.
Okay, Abby, you have a great day. Thank you.
Thank you. You too.